been talking about sickle cell disease, and in the first part, I pretty much painted a very depressing view on sickle cell disease. I think we need to have a better understanding, like I said before, of the problem. I'm going to title this segment Anatomy of a Crisis, and basically we're going to talk about what happens when a child or an adult has a crisis. So basically it all starts with the cells. Really it starts with the genes. So there's a problem in the genes that makes a cell, the red blood cell, more susceptible to what we call sickling. So this is a normal cell. When they're produced, most red blood cells are normal, even in sickle cell diseases. In sickle cell disease, the problem is that under certain conditions, some of them might be dehydration, infection, emotional stress, pain. Under conditions, pressure is placed upon this cell, making it morph into what is known as a sickle cell, and hence the name sickle cell disease. Here's the problem. These cells, these healthy cells, can last up to 120 days. These sickle cells last about 20 days or even less if you're unlucky. Now, the other problem is that these sickle cells are harder and more brittle, and as you can see, they have a sharper shape. The normal cells are round and pliable, and they can move through blood vessels very, very easily. These cells are the ones that carry oxygen and some other things that the body needs. Therefore, you can easily see that once it becomes sickled, it can't do what it's supposed to do as well. So one of the problems, obviously, is that many times patients with sickle cell disease, and when they're having a crisis especially, they lack oxygen. So oxygen is a really good form of therapy for them. That's just by the way. So once it forms a sickle-shaped cell, one of two things can happen. And basically, the two of them happen simultaneously. Usually one predominates over the other. I have a whole family of kids, 4 kids. The first one, what happens here is that this cell ruptures. You can see it basically disintegrates. And what happens is that when it disintegrates like that, it sets up a whole chain of reactions in the body. The body reacts to it because it releases a lot of the things that were supposed to be inside the cell. It's released into the system. Some things like iron, things like heme, and I'm not going to go into the biochemistry too much, but these chemicals can cause damage. They're not supposed to be out in the open like that. They're supposed to be contained within the cell. But when things, like I mentioned, when there's pressure, the cells can explode and cause all kinds of problems. The PCV of the child drops. That's why they need blood transfusions. And a lot of different things can happen, especially over a long period of time. So it's not a good thing. The other thing that can happen to the sickle cell is that it can actually block. So this is an artery or blood vessel. Blood is supposed to flow freely into the heart, the lungs, the bones, the skin, the tissues, and all those things. But what happens is that this cell, this sickle cell, can block these areas. Once blood flow to any part of the body is affected, the first thing the cells do in that affected area is to start screaming for help. We need oxygen, we need nutrients, we need glucose, we need this, we need that. And the way they scream is that they send out chemical signals. These chemical signals, in most cases, cause a lot of pain. That's why you have in children, you have the swelling of the bone, swelling of the joints. You see them crying out in pain. It's actually the body that is releasing those chemical signals that cause the pain. Because it's like we are not getting enough oxygen, we're not getting enough nutrients, and therefore do something about it. And the way the body does something about it is that it alerts you, and there's pain, there's swelling, there are also other things that obviously some of you may know about. It's not a very good sight. Where we're concerned, the area we're concerned in is the organs that are extremely important. And so the concern is that the kidneys, over a period of time, the kidneys can become damaged over a period of time. This is the brain. I mentioned earlier on that we started seeing children with strokes as a result of sickle cell disease. So you can think about it. The blood is supposed to flow to this part of the brain, and if the blood gets blocked, if the blood flow gets blocked, the brain cells can die off if it's not addressed quickly enough. These are the lungs. What we know is that over a period of time, the lungs begin to get damaged over a period of time because they're not getting enough oxygen, they're not getting enough blood flow. And so many kids you see with sickle cell disease, they tend to wheeze, they tend to have difficulty breathing. They certainly don't have as much energy as other kids do. They can't play football as much, for instance. Over time, the lungs begin to get scarred if nothing is done about it quickly. The heart too, this is the heart here, the heart too can get affected. This is a picture of the bones. Osteomyelitis, an infection and damage to the marrow of the bones, is another problem that can arise as a result of sickle cell disease. But again, you got to look back at what happens at the beginning. The problem is that these cells in these children that have sickle cell disease and adults are more susceptible to pressure. They are more susceptible to pressure, and that changes them from a normal, nice, pliable, elastic cell to a less elastic cell, to a really hard, brittle cell, which can easily either disintegrate, and cause problems in the system, or it can block the arteries. Which I don't know which one is worse. I've spoke to my hematologist friends. In some kids, for whatever reason, they tend to go this way. In other kids, they tend to go this way. But they all sort of happen in the same child. It's just that one predominates over the other. And so that's the problem that we see in sickle cell disease.